Okay, Assalamualaikum and very good evening. Thank you everyone for joining the session and thank you for being on time. Can you all just comment in the chat box if you can hear me clearly? Okay, thank you. Okay, so we link on YouTube as well. Okay. So thank you everyone. So I assume most of you or all of you already got your hospital. Can you all kindly comment which hospital you will be reporting duty soon? Okay, so tonight we'll spend about 45 minutes, maximum 1 hour if you all have questions. Okay. Okay, you can get to know each other in the chat box. I think ada yang a few yang dapat UM, the lucky ones. Okay, the rest are hospital, state hospital. Okay. Okay, so tonight will be about mentorship revision briefing. It's actually very brief. Just some technicalities, but I'll put the mentorship revision briefing towards the end of the session. Since we have gathered together in Zoom, let's just do some quick reality check on what is the current workload for houseman. Okay, what is your day-to-day job or task, or what do we expect from you on your first few days as houseman, as taggers? Okay, so that when you are clear with what we expect from you, what is your job scope on your first few days as tagging, so hopefully that will give you some motivation and some clarity on what you can prepare during your last few days before you start working soon. Okay. Okay, so there will be 4 parts of our discussion tonight. Okay, so the first part, the gist of the discussion is reality of tagging. What is your current workload? I will share feedback from your senior houseman. Okay, I will share some of tag assessment form. Okay, since you start tagging soon, usually there will be not much time to prepare or to study for your off-tag assessment. So saya akan bocorkan soalan off-tag or the common diseases in each department. So please take some time or some effort to work on the theory part. Okay, revision. Okay, I know you will be busy preparing your documentation. Some of you will need to move to another state, so there's additional logistic arrangement as well. Okay, but the most important preparation is your skills and your knowledge. Okay, so let's spend some time on that. Okay, so I usually advise at least 1 to 2 hours of serious studying. Okay, 1 or 2 hours per day of serious buka buku ke YouTube ke whatever to refresh kan you punya teori sebelum start tagging. Okay, so the first part is reality of tagging and after assessment, and then from that reality check we will brainstorm or hopefully you know what is your knowledge and skills gap. Okay, antara our expectation kami, okay, what we expect you as taggers to perform on your first day. So you reflect back whether you are confident enough to perform all these tasks. Okay, if not, then that should be the things or the list of things you need to prepare before you start working soon. Okay, and the last part before we end our session is how to join the mentorship provision. Okay, it's quite easy. Just follow a few simple steps, but you need to follow all the steps so that you don't miss the revision. Okay, so if you have any question, feel free to ask in the chat box. Okay. Okay. So this is what you will encounter or experience for the next few weeks. Okay, your PTM will be on 26, if I'm not mistaken, betul? Okay, 26. You'll spend one day at the hotel, okay, for your PTM. Okay, so, oh, sorry. Okay, so after you submit the mentorship survey form, okay, saya akan share the survey form towards the end of the session. In that survey form, you will get the link to join your senior houseman WhatsApp group. Okay, so please join the respective hospital WhatsApp group. You have all your working senior houseman inside that group. I have also shared what list of question you can ask, okay, about you to your seniors, okay. Boleh tanya dokumen apa nak prepare, department mana yang tak cukup houseman, what are the available accommodation nearby your hospital, okay. So please make full use of your hospital WhatsApp group, okay. Meet and greet your senior in the group, okay. So and please commit to the mentorship revision as well. Okay, there will be series of case discussion or tasks that I will share from my phone to you via WhatsApp. Okay, so please spend some time to go through the notes or do the tasks. Okay, okay. So mentorship revision. Your PTM will be on 26. Okay, and then after 1 week. Okay. Yes, 26 February, and then you have your hospital orientation. This is usually another 1 week, okay. And what important during hospital orientation is you will get to know your first posting, okay. And then most hospital will have weekend off before your actual tagging start. Okay, so please everyone, once you got to know your first posting, so usually you tahu you punya first posting hari Rabu atau hari Khamis, and most hospital akan ada weekend off before you start tagging the next Monday. Okay, so please arrange with your senior houseman since you dah ada access ke senior houseman punya group. Arrange for pre-tag with your senior houseman. What is pre-tag? Pre-tag is orientation to your particular department. Okay, so hospital orientation only orientate you to the hospital, but there's no proper orientation for your particular department. So you have to be proactive. Arrange pre-tag with your senior houseman. Nanti dah tahu posting apa, just hello sini dalam WhatsApp group cakap, okay, kita orang ada 4 orang reporting duty to PITS. Next week, can we have a look at the ward during the weekend? Okay, so that is pre-tag. Okay, I will cover more on pre-tag in Clash HO induction. Okay, okay, so you'll start tagging the next week. Okay. So for this intake, okay, for Muslim, take note that you will start tagging 1 day before Ramadan start. Okay, so need to do the necessary preparation lah. Your hospital orientation seminggu, okay, PTM seminggu, hospital orientation seminggu, then tagging ni we actually have started puasa. Okay, so there will be another challenge for you all lah. Okay, so next is, okay, this is from last intake in October. Okay, so I follow up after few days of tagging. So it is quite common. Don't ask me which hospital it is because the trend is almost the same for any hospital. Okay, one houseman jaga 26 patients. Okay, need to cover 2 wards alone. Okay, so it will be challenging. So please prepare yourself well lah. Okay, in term of apa tu, your expectation, mental preparation, and also your theory and skill as well. Okay. Okay. So what to expect on your first day? Okay. Um, can I have some suggestion or answer in the chat box? What do you think you need to do on your first day, doctors? First day of tagging, I means first day you step into the ward as houseman after your hospital orientation and everything. What do you think you need to do? To know the working system, introduce first, okay? Try not to kill anyone, okay? Okay. So, this Friday we'll have a flash ratio induction. I will go into more detail on what we expect from you and what you should expect from us on your first few days, okay? But I'll go briefly, okay? So, what your job scope as taggers is more or less the same as what any senior houseman do, okay? So, apa yang senior houseman perlu buat dekat ward? When you as taggers step into the ward, your job scope is the same. Okay, so apa yang senior houseman perlu perform, you perlu buat jugalah. Okay, so your first day in the department, usually you will need to report duty to the clinic dulu. Okay, then the rest of the day, lepas report duty kat clinic at 9 or at 10 a.m. in the morning, you dah report duty to the ward lah. Okay, so this is roughly what will happen during a day in the ward. Okay, so whatever senior HO supposed to do, any takers pun perlu buat benda yang sama. Cuma mungkin your senior houseman are in charge of more patients compared to you on your first day. Mungkin you'll be in charge of half or less number of patients. Okay. Okay. So the usual day in the ward, okay, you have to come to take the morning blood, okay, for the patient yang in charge, okay. Let's say the houseman yang kita tengok tadi, dia kata dia jaga 26 patient kan, 26 patient. So usually for medical, maybe 1/3 or half of the patient will need a morning blood. Means every day kita akan repeat certain investigation for some patients, okay. So you need to come early to take the morning blood and then trace the investigation and then do your review to your patients. Means you need to assess how's the patient doing. Okay, so kalau ada 26 patient means you have to trace investigation for 26 patient and also you have to ask, examine and do documentation for all the 26 patient in your cubicle. So that will definitely take some time, especially when we are new. Okay, so around 8 o'clock your MO will come. So you are expected to present those cases to your MO. Okay, in some wards, your MO and specialist come together. Okay, tapi ada juga certain ward MO datang dulu, so houseman present kepada MO. Then afterwards, when specialist datang, MO or houseman present pada specialist lah. Okay, then when the round finish, so usually MO and specialists will go to the clinics, okay, or see referrals in other wards. So houseman, including the taggers, you will need to stay in the ward to settle all the ward work. Okay, your ward work include new blood taking yang baru MO and specialist order during the rounds, any referral to other department, okay, any scan request, ultrasound, MRI, CT scan, okay, because you're doing your housemanship in large tertiary hospital. So we have all the imaging modalities. We have MRI, CT scan, ultrasound, some fancy imaging like PET scan, okay. So houseman need to MO and specialist order the one yang kena request to the radiology team is usually houseman, okay. And also consent and prepare for any procedures, okay. Prepare the patient, you prepare the equipment, you prepare the consent. For those who start in surgical based department, so you will need to prepare patient for OT, okay, you will need to request ataupun book operation for your patients, and last but not least is all the discharges, okay. So this is what any senior houseman need to do, and this is what you will need to do on your first few days of life juga. But as taggers, supposedly you will have another senior houseman working with you to guide you if you not sure of any certain things, everything like that. But if you are in charge, okay, of 26 patient, means your senior houseman have another 26 patient of their own as well. So it could be quite difficult for the senior houseman to teach you everything. Okay, it will be much easy if you can perform all these blood taking, referrals, can request discharges, okay, with minimal minimal guidance from your senior houseman, okay, because they also have their own vision and job scope, okay. And your day doesn't end dekat pukul 11 kan. Meanwhile, you will have new admission arrive to the ward. So new admission usually will pass to the tigers to clerk because you need to be familiar with the common cases yang arrive to the ward. Okay, so clerking means you have to ask a set of questions to the patient, do physical examination, and it also includes formulating plan of management. Okay, case to case basis lah. Kalau you clerk case contoh pneumonia, then what is the plan of management? Kalau you clerk patient ACS in medical, for example, what is the plan of management? Okay. So and then clerking new case, and then all the patient in the wards will have some active complaint, right? Because they are unstable. So ada yang complain, doktor sakit lah, susah nafas lah, okay. And then you'll be bothered by the staff nurse as well. Doktor tolong order ubat, doktor branula tercabut, doktor rice tube tak ada, doktor catheter tak ada nak pergi operation, okay. So you will need to help your nurses as well. So all these procedures are HO level procedures. Branula, blood taking, CBD, rice tube, okay. You are expected to perform on your first few days as well, okay. Okay, and then as usual, we have unstable patients. So if the patient collapse, usually only housemen are always in the ward. Your MO will be in the OT ke, in the clinics, okay. So any HO need to be able to identify any unstable patient and do the quick assessment before you can call and inform your MO regarding the patient, okay. So the good news is BLS will be part of your hospital orientation for most hospital, okay. But remember, BLS is what we practice outside hospital for laymen. To resuscitate patient in the ward, usually the steps are quite different lah, okay. Okay, so you will be repeating everything at 2 p.m. for your PM round, at 8 p.m. for the night round, okay. Forget, you will have teaching to attend, you will have assessment for you to prepare afterwards, your off-tag assessment. Try to off-tag on time so that you tak penat sangat, sebab tagging ni kita kerja lama kan, keluar pagi balik malam, okay, it will be extremely tiring. Prepare so that you can off-tag on time. Once you be in the shift as any senior houseman, your working hours will be more flexible. Ada off day, ada kerja malam sahaja, ada kerja siang sahaja, okay. Okay, and pass over before your shift. Okay, so based on what we have go through for the past 10 minutes, this is what we expect you to do. Means when you step into the ward, we will start giving orders. Okay, can you, patient ni perlu ambil darah, doktor scan request. Okay, so these are your job scope. Okay, if you think you are not familiar with some of the tasks or some of the procedures, take some initiative, find ways to learn or to practice, because it will be quite overwhelming for you to learn or begin from zero. Okay, especially for your intake. First intake of the year means the last intake, HO intake was somewhere in October. So dah 4 bulan tak ada new houseman. So all or most of the department are currently running on very critical number of housemen. Okay, it also means bila you masuk department tu, there will be very few senior housemen to guide. Okay. Okay. So these are 5 core knowledge. Okay, so apa yang houseman kena tahu? Okay, what you need to know before you step into the what? Okay. First, obviously, is the common medication use. Okay, so common medication use in Malaysian hospital. Okay. Second is common diseases. Okay, common diseases in each department. Okay, usually the common diseases and common emergencies are part of your off-tech assessment. Okay, so kalau obstetric is obstetric emergency, kalau ortho is orthopedic emergencies. Okay, that is will be part of your off-tech assessment and also end of posting assessment, common cases and common emergencies. Okay, I and N, okay, is what you can work on in the next few weeks. Okay, the common diseases as well lah. Yang ni pun kena revise juga, common disease. Baru you tahu nak clerk and nak review patient macam mana, nak formulate plan of management. Okay. Okay, so investigation interpretation, doctors, please revise your chest x-ray, interpretation, ECG, ABG interpretation, okay, how to interpret ABG, and also CTG, another thing. Most of you will start in either medicine or ONG usually, because these two departments are the largest department of the hospital and they need most or more housemen to run the department. Okay, chest x-ray, ECG, ABG you will encounter in any ward, bukan medical sahaja. Add on CTG in the list of your revision. Okay, so that nanti bila you tengok ECG street, ABG street, you have some idea how to interpret. Okay. Next is normal value. Okay, please try to hafal. Okay, what is the normal value of your FBC, your platelet, hemoglobin, total white? Simple kan? Adult punya range lah. Okay. HB, normal HB berapa, normal platelet, normal total white cell, your renal profile, your urea, creatinine, and your electrolytes, sodium, potassium. Okay, urea, creatinine, sodium, potassium, your LFT, liver function test, and coagulation profile. Boleh, everyone? Before you step into the ward, please make sure you hafal the normal value, or else ramai housemen yang baru trace result, then but they don't realize that it is not normal because you tak hafal lagi what is the normal value. Okay, and last but not least is common abbreviations. Okay, common abbreviations. I will share shortly in my Telegram channel. Some labor room protocols, some HO guide, Ampang HO guide. Inside all those guide are list of common abbreviations, list of documentation, for example, tracking notes, and also review. Okay, so go through that Ampang HO guide, labor room protocol, so you will somehow familiar yourself with the common abbreviations. Okay, so jangan lupa hafal normal value and please take some time to revise your investigation interpretation, chest x-ray, ECG, ABG. Okay, you have learned all this in your med school, just need some kickstart revision to make sure your neurons semua activated semula lah. Okay, and common diseases as well. If you're not sure where to start, at least start with medicine and ONG. Cover the common emergencies and common cases. Okay. Okay. So kalau you tak sure nak start baca dekat mana, everyone, okay, please, okay, you can, I think most of you are familiar with Medicop Teachable website. Okay, Medicop Teachable, you can simply Google up Medicop Teachable. Okay, let me type in the chat box. Okay. Okay. So Medicop Teachable, and then find this free module. I think some of you have subscribed to this free module. Okay, kalau yang tak pernah dengar, pergi sekejap if you're not on your phone. Welcoming session. Okay, in these free modules, ada 5 major department that you might start as your first posting. So ONG, medicine, pediatric, ortho and surgical. Okay. If you haven't gone through this department welcoming session, please take some time, at least hari ni hari apa? Hari ni hari Rabu. Okay. Start tomorrow. Satu hari cover satu department. Okay. Maybe esok you start dengan ONG. In each department, what we cover is what are the common cases in ONG, in pediatric. There will be some case discussion. And what are the skills that you need to know or you need to have when you start as houseman in that particular posting. Boleh, everyone? So please cover this department welcoming session so that you know for each posting apa cases yang common. Okay, these common cases are the cases that you will need to review, you will need to clerk. Okay, you need to formulate the plan of management. Okay, and you also your off-tech assessment pun akan go around all these common cases. Okay, so please spend some time next week to cover at least one day, one department, and then go through the apa common cases yang kita orang kata, okay, PIDS, you will encounter this disease, this disease, this disease. So reflect whether you still remember those common cases or not. Okay. Okay, if you think you need revision ataupun dah malas nak baca, or bukan malas nak baca, sometimes we don't gain much from reading. Okay, so Medicop have this pre-record session by your specialist and medical officer from respective department. We cover at least half of the common diseases for each department. Okay, so you can enroll. It's available on our Teachable website as well. Okay. Okay. So just now I have shared with you 5 common, 5 core knowledge. Okay. So 5 core knowledge was your common medications. Okay. When you start tagging, okay, you can ask from your senior houseman what the common medication list for each department. Common medication list and common and the dosage as well. Okay. Common diseases, okay, go through the department welcoming session. Investigation, interpretation, read up your notes or any books or YouTube or mana-mana lah, okay, any resources we have. And please, your normal value, try to remember them. And common aberration, go through the resources that I will share shortly tonight on my Telegram channel, okay. Okay, so what are core skills? Okay, core knowledge tadi memang you kena study, memang you kena revise sebelum you start houseman. Core skills is what you need to perform later. Okay, so based on your knowledge on the common diseases, then you will need to know what question to ask your patient. Okay, contohnya you attend patient yang ada exacerbation of asthma, okay, of bronchial asthma. So apa yang you nak tanya patient tu during clerking, review or attend patient dalam dalam what, okay, bila patient complain shortness of breath, okay, so what you need to ask the patient, okay. Kalau you ada knowledge atau you masih ingat the common sign and symptoms, then you will know what question to ask, okay. Next is what to document, okay. You will write a lot as houseman, okay. After you clerk, you akan document your clerking notes, and then you have your blood take investigation forms, okay. Kalau you buat referral, you buat scan request, semua tu ada dia punya different forms to fill. Review, you will document as well your 4D SOAP and discharge summary, okay. So banyak berkomunikasi dengan patient, dengan kita punya MO, senior houseman, then okay, document, and then how to communicate. So whatever documentation you produce, you must be able to communicate them with your colleague and with your senior houseman, with your MO. So you need to present the case. Kalau patient tak stable, macam mana nak inform, macam mana nak refer, request, post case. Okay, these are the things you need to communicate. Okay, and last but not least is how to perform physical examination and procedures. Okay, so all the core skills ni, okay, is what we will cover. Medical will try to cover in Flash HO this Friday. If you have joined the Flash HO before, you are feel free to rejoin the live session again. Okay, this Friday. Okay, in Flash HO, I will demonstrate you or show you example of clerking forms, review, okay, and we will have more practice in advanced HO next week. Okay, so advanced HO you will have more practice, okay, because it's 2 days and flash HO is only 1 day on Friday. Okay, in terms of procedures, okay, if you think you need help to brush up your skills, these general clinical procedures that HO need to know. It is taken from HO logbook. Okay, ada 10 procedures that HO need to know in any department. Okay, venar puncture, granular insertion, ABG, okay, blood culture, CBD insertion, nasogastric tube, and also CPR. Okay, so we cover all these procedures in Medicorp Clinical Skills Workshop, and we also add on additional skills compulsory for ONG. Okay, speculum, VE, ARM, how to conduct delivery, and placenta. Okay, so if you think you need help to revise or brush up your skills, feel free to join our clinical skills workshop. We'll have a few more sessions before your actual, before your PTM date. Okay, those who have joined the clinical skills workshop before, you can come again as facilitator for free to brush up your skills. Okay, okay. So regarding the procedure, okay, you are as houseman bukan kena tahu perform procedure itu sahaja. You will need to know the indication, okay, when you need to perform. So all these procedures kan are considered HO level. By HO level bermaksud as houseman, you will need to know patient mana yang perlu ambil venous blood taking, mana yang kena masuk granula, mana yang kena ambil EBG, mana yang kena ambil blood culture. Bukan semua based on order daripada you punya info. Okay, so you need to know what are the indication for these procedures, and you also need to know what are the contra indication when you need to do and when you cannot do is important as well. Okay, step by step how to perform the procedures, common complication that might arise from the procedure, and also how to document them in the patient punya case note. Okay, So this clinical skills guidebook, you'll get a copy for free when you join clinical skills workshop, or if you don't have time to join the workshop, you can just buy the book. There will be a lot of QR code of video demonstration, and also some notes on indication, contraindication, possible complication. What's more important is items that you need for that particular procedures. Okay, and also step-by-step guide based on HO logbook. Okay. Okay, this might help you regarding the uh, compulsory procedures. Okay. Okay. More sharing from your senior houseman. Okay. Again, most of you will start with medicine or ONG. So please be prepared with the common diseases, okay, common emergency for these two departments, okay. Go through the department welcoming session next week, okay. So ONG, okay, third day of tagging, you are expected to be functioning despite being a taggers, okay. So dah kena buat newborn examination in labor room, referral, postnatal review in labor room. Okay, so this is how to do review. I cover how to do postnatal review in the department welcoming session for ONG. Okay, so it's free module, no excuse for you to not to watch them. Okay, okay. So this is a review for the SOAP. Okay, we will learn this in Flash and advanced HO, and also in any pre-record department punya course. Okay. And your plan of management, our Venoms formula. Okay. Hopefully most of you yang dah join Flash and advanced HO before are quite familiar with this Venoms formula. Okay. In Flash HO, I will explain in more detail. In advanced HO, we will have more practice on how to formulate management for common cases in few departments. So kita ada case daripada ONG, daripada PITS, daripada Ortho, so that you get more understanding on how to formulate plan of management. Okay, so hopefully bila you jumpa real patient dalam ward nanti, you have some idea on how to formulate plan of management. Okay. Okay, prescribing medication is your daily task as well. Okay. So usually for you to off-tag, they will make sure you remember the common medication punya dosage. Okay. So jangan lupa minta daripada sini houseman nanti. Common medication list. Okay. And this is example of off-tag assessment. Okay, this is for medicine. Regardless you dekat mana-mana hospital pun, the requirement is more or less the same. For medical department, they will require you to know how to attend patient with in-ward emergency. For example, patient ada shortness of breath. So what you need to do, ABG interpretation, okay, hyperkalemia, your ECG changes in hyperkalemia, chest pain, again, ECG interpretation, hypotension, if a patient develop hypo or hypertension, what you need to do as houseman before you inform your medical officer. Okay, so we have pre-record online course on this, ABG and medical emergencies. Some of you who registered for full advanced HO, we have enrolled you into this free module. So please take some time to go through the recording. Okay. So you will encounter all these emergencies not only in medical department. Dekat surgical pun ada patient hypertension urgency, DKA. Dekat ortho, dekat ONG pun ada patient yang desaturated, suddenly the SpO2 drop. Okay. Collapse patient, what are the approach? So please take some time, arrange your time before you start PTM nanti. Okay, spend 1 or 2 hours of serious revision. Nak baca buku ke, nak watch and the online course or YouTube on all these topics. Okay, And these medical emergencies also will be frequently asked question. Okay, favorite question for you to off-tag, especially in surgical and medical department lah. Okay. For ONG, usually the off-tag assessment will be management of labor. Okay. Okay, and these are example of off-tag form in pediatric. Okay, again, okay. So some department, the off-tag assessment or the off-tag form is quite general macam ni. Okay, they just list what you need to do, what you need to know. But some department are more particular. Okay, usually PIDS department are quite particular lah. So they will list down list of disease and berapa case yang you perlu clerk. Okay, berapa any specific procedures you need to perform. Okay, if you can see here, venipuncture. Okay, both neonates and infant, and then IV cannulation, blood culture, ABG. Okay, so again, these are common procedures that we have go through before, and it also cover the common diseases in each department. Okay, so that's why you need to have some theory on the common diseases, and you also need to have some skills on the common procedures. Okay. Okay. These are mandatory topics on pediatric from HO logbook. Okay. So my team have help you to highlight the common diseases. Okay, 16 ni semua compulsory topic you need to know for pediatric, and your end of posting punya soalan will be one of these 16 topic. Okay, tapi daripada 16 ni, the common ones are the highlighted one. The means these highlighted diseases will make up most of the patient in your ward. Okay, yang kita tak highlight tu jarang-jarang sikit lah. Okay, so you tak tahu waktu mula-mula posting pun tak apa. Okay, you can get to know later. Okay, but the common diseases will be cases you encounter during tagging for your off-tag assessment. So tolong revise all these common diseases before you start. Okay. Okay, again, we have the pre-record department punya course. Okay. And last but not least, don't forget to pre-tag later. Okay. So kalau you tengok dekat sini, you are expected to work fast. Better to have all templates to all kinds of entries and review. This is another thing that you can ask to your senior houseman. So usually they have list of common medication, they have list of procedure punya entry, okay, template untuk review antenatal, postnatal, okay, template of plan of management for common diseases. So please ask this from your seniors. In fact, you boleh tanya before start tagging pun boleh minta diorang department guide ke apa, so that you can study, minta labor protocol for example, so you can print out and study or baca lah. Familiarize yourself with the abbreviations and common diseases, format of review, entry, everything. Okay. So tak adalah bila start tagging baru nak catch up everything. That will be extremely overwhelming for everyone. Okay. Okay. So Flash HO is this Friday. If you want to join, there will be a recording. Okay, and more practice on during our advanced HO next week, Monday and Tuesday. Okay, so last but not least, we come to the most important part, mentorship revision. Okay, so please follow these steps. Ada dua saja step. Okay, first, save my number in your phone. The number is what you can see on the screen. Okay. Kalau you tak save my number, doctors, WhatsApp broadcast is what orang selalu guna untuk blast iklan. Okay, kalau you beli baju ke apa kan, then the seller akan cakap, okay, save my number. So please, kalau you tak save my number, walaupun saya send revision tu dekat you, you tak dapat. Okay, so save the number and submit the mentorship revision survey. Okay, sekejap saya share dekat link. I will share the link at my Telegram channel as well. Okay, so please take some time. Okay, mentorship revision, mentorship survey ni agak panjang, tapi dia adalah lebih kepada reflection on what are common tasks yang houseman perlu buat, and you need to rate your confidence level, okay, on that common task. And then at the end of the mentorship survey form, ada link untuk you join Senior Houseman WhatsApp group. So kalau boleh join tonight, so hopefully esok you can start asking questions in the group. Okay, kalau you join lambat, nanti you tak nampak lah soalan-soalan yang kawan you dah tanya. Okay. Okay, I will share the mentorship survey form link at the YouTube as well. Okay, any burning question before I end the session, doctors? No. Uh-uh. Uh, okay, I have shared the mentorship revision link at Telegram channel, in the chat box, and also at YouTube. Okay, so please take some time to submit the um, survey, and then please join the senior houseman WhatsApp group. Okay, hope to see you all in Flash HO this Friday, Advanced HO on next Monday and Tuesday, and also we'll start our mentorship revision on Wednesday. Okay, so please commit to the revision letter, and please start asking questions in the senior houseman WhatsApp group. Okay, you have helpful seniors in the group. Feel free to ask questions. Okay. Okay, if no further question, I will end the session now. Thank you so much for your time. Okay, good night, everyone.